So we're back, and now we're going to switch gears just a little bit. We've been talking about the flu and, you know, the steps we can take to keep ourselves on the healthy list. Now, you know the expression, there will be a quiz. We are all going to take a little health IQ quiz together. And what we're talking about now are some of the issues that are especially important to women. Some of the health issues that for women, we tend to put ourselves at the bottom of our health list for sure. And it's stuff that we should all know about, especially female health. Our next guest is going to help us separate fact from fiction when it comes to some of the most common health issues women face. Please welcome back to our show. She's a woman, too. Also, Chief Medical Officer for Pfizer, Dr. Frida Lewis-Hall. You know, there are expressions like, you know, what you don't know can hurt you, or ignorance is bliss. These things are not true when it comes to health, correct?
These things are so not true with health. You really need to stay on top of information. And here's the thing. There's so much information available now that people think they're in the know. You know, people think like, oh, I know this and I know that. Well, it's always important to stay informed, and science moves forward. So the thing that you knew last week, last year, last month, may have been updated now, so we really have to stay on top of things.
So what we're gonna do is you guys all have little voting devices there. I have no idea what these questions are. I haven't taken this quiz yet myself, but we're going to test our health IQ. So let's take a look at the first question.
So the first question is especially important for people who are living with diabetes. So question number one, of the following foods, which one raises blood sugar the most? A, raisins, B, ice cream, C, apples, or D, chocolate-covered peanuts?
God, I have absolutely no idea.
This is an interesting one.
I'm gonna say something that would be surprising to me. Like, I'm gonna pick the most surprising thing. I'm gonna say A. I'm gonna say raisins. Let's see what the audience said. Wow, everybody said raisins.
Wow.
Are we right?
You are right.
We're right! Now, why?
Because it's a smart audience.
We are good people.
Well, first of all, we picked diabetes to talk about a little bit because diabetes is so common. 26 million Americans suffer with diabetes, and another 80 million have pre-diabetes. So
type 2 diabetes we're talking about, or type 1 and 2 together?
Type 2 diabetes.
That's the one that's
this is the one that's related. That's exactly right. So we really need to make sure that people understand what it's like to try and manage diabetes. And this is a really good question because it talks about the use of something we call glycemic index. And the glycemic index and glycemic load essentially gives you important information on what the food does to your blood sugar level.
Gotcha.
So what the food does to your blood sugar level. Okay?
Right.
So this amount of raisins actually has the highest glycemic load.
Index.
28.
Wow.
28
of everything that's there.
Of everything that's out here. This apple, about 3. So an apple about 3. A scoop of ice cream.
3 to 28, that's huge.
That's exactly right. And the scoop of ice cream, which my husband loves, right? Depending on the ice cream, 3 to 6.
Oh my God, it's like eating an apple.
Exactly right.
If you're looking at glycemic,
if you're looking at glycemic,
right.
She's like, oh. And
did you hear how happy I was there?
Yeah. Well, let me tell you what I was happy about. I was happy about these chocolate-covered peanuts. When we were doing this question, I was like, ooh, thank goodness, because I just got finished with a handful. So this serving is about 12. So think about this. 28 versus 3 to 6, 3 and 12.
Have me a peanut when we go to break.
So
it's shocking.
But I want to add a couple of things that I think are important about glycemic index and glycemic load. Interesting tools to use, but you have to remember it's one part of how to choose a healthy food.
Right.
So how to make a healthy food choice. And you want to consider other things, you know, like the vitamins and other nutrients that are in there. That's important. The second thing is amount matters. So if you look at these sizes, portion control is really important.
Portion control is so important for all of our health. You know, it controls, of course, the obvious, your weight, but you know, eating the right things, all things in moderation, these are big things.
Exactly right. So my mother was right. All things in moderation, and balance is important. So you can still have something that has a high glycemic load, but you want to make sure that that's balanced out.
As long as the map of the rest of the day can absorb it.
Exactly
gotcha.
right.
All right, let's take the next part of the quiz. Which of these may be a symptom of a heart attack in women? Oh, I'm sorry. I read the question for you.
That's fine. That's fine.
Yeah, read what our choices are.
So A, the loss of balance, B, a fever, C, jaw pain, or D, a skin rash.
I didn't know any of those were a sign of heart attack. I thought it would be like the shooting pain in the arm thing. I'm gonna go with A again, like loss of balance. Because maybe if my heart was beating irregularly, the blood wouldn't be going to my head or something, but I have no reason to know that. Apparently, everybody else is way smarter, and they said C. Everybody says C.
Everybody said C.
Yeah.
So the correct answer is jaw pain.
Really?
Jaw pain. So, you all are just so good.
75% of them, they are very big-brained people.
That's it. We're going to have to get trickier questions.
Why does your jaw ache?
So here's what's really interesting. So most of us were brought up seeing someone grab their chest with the chest pain and pass out, and that's a heart attack.
Right.
Well, chest pain is one of the most common symptoms for both men and women. But recent studies have told us that about half of women who present with a heart attack actually complain about chest pain. We complain about a range of other things. So if you think about all the other ways in which your heart runs your body, women complain of lightheadedness and dizziness, so they're head symptoms. There are also pain symptoms. We talked about the jaw, the neck, the back, heartburn and indigestion, nausea and vomiting. These are all symptoms that are reported with heart attacks. And last but not least, and common in women, is extreme fatigue. So I know we're tired a lot anyway, but this is an important one because it helps remind us that the symptoms of a heart attack don't necessarily just come that day all of a sudden. They can come hours, weeks, and days before.
If I had jaw pain, I would say, oh, I gotta go to the dentist. I got a bum tooth.
That's why this information is really important.
Wow.
And especially important because heart disease remains
number
the number one killer, both men and women. And women are often underdiagnosed or misdiagnosed. And here's the message that I really want for women to know, because what we had talked about at the beginning, women will say, well, you know, it'll be okay, I'll do better, I've got to take care of the kids, I have to get dinner ready, I have all of these things to do, I can't pay attention. If there is something that is happening to you, something that's new or makes you uneasy,
get to the doctor.
Check it out.
Get to the doctor.
Check it out.
All right, number 3. Oh, sorry, you go ahead.
So which of the following are considered risk factors for breast cancer in women? A, starting menstruation before age 12. B, reaching menopause after age 55. C, having a first full-term pregnancy after the age of 30. Or D, all of the above.
I have no clue. I'm going to go with D. Just say all of the above. Just slap it on out there. You guys, go ahead and vote, and we'll tally it up. Everybody went with me on that. 92.
All right. We're going to have to stop you from guessing, because you're just getting all of these right.
Good job, guys.
Yes, it is a great job. So, yes, D is all of the above. These are all risks, small risks, and there are a lot of other risks for breast cancer. The important thing to remember about risk is that the biggest risk is really being a woman and having breasts and getting older.
Right.
And if somebody knows how to fix that, like, holler.
Exactly.
Okay? So, you know.
Early detection.
Early detection.
There are so many solutions now for people with breast cancer. The survival rates are so...
They're huge.
Huge.
Oh,
stop being afraid. Get in there and get it checked.
And breast self-exams at 20.
Absolutely.
Complete breast exams at 30. Mammograms at 40 and beyond.
Mammograms 40 and beyond. You can't just get one and say, oh, that's done.
You got to stay at it.
Up next, let's go. Pop it up there. I want to make sure we have time for all of these, guys.
All of the following have symptoms that mimic Alzheimer's disease except A, chronic alcoholism, B, excess iron in the blood, C, urinary tract infection, D, dehydration.
Except, I would say C. I wouldn't think of that as having anything to do with Alzheimer-like.
Okay,
symptoms.
well, let's
I'm going to guess C. What do you guys guess? See what the vote is? C, but not an overwhelming landslide, but 50% of us, 53%.
So the answer is excess iron in the blood.
What?
What? How can that be? Except, remember saying we're except.
Weird.
So let's talk about this. This is a very complex issue, and I want to make sure that people kind of have some ideas of what to do with this information when we're done. So first of all, a lot of people talk about Alzheimer's and dementia as though they're the same thing.
They're not.
They're not. Right. Dementia is a group of symptoms that describes changes in memory, thinking, and reasoning.
Right.
And frankly, a lot of things can cause that or can mimic it. And so if you think about something like chronic alcoholism, there's a chronic effect on the brain.
Right.
If you think about something like dehydration or urinary tract infection, they can cause delirium. And delirium is acute, right? It comes on suddenly, it fluctuates, and mostly changes focus. People may be incoherent and disoriented. But the important thing to remember is these confusing things are treatable. So it is important to not say, well,
if it came on quickly or you have any of these other things going on, it's not Alzheimer's necessarily. It could just be delirium.
You have to have it checked out because there are some treatable things that mimic Alzheimer's, and you want to make sure that you get treatment if it's available.
We want to make sure we get the fifth one in. Let's pop it up.
Last but not least, which of these may be a symptom of menopause? Urinary tract infections, breathlessness, blurred vision, or shaky hands?
Which of these may be a symptom of menopause? God, they all sound awful, don't they? I don't want to vote on it. You vote. That one bums me out. Everybody says C, though, 44%. So are they right?
Yep, so urinary tract infections is a common occurrence for women in menopause. So the answer is A, urinary tract infections. So why do we say that? People are like, urinary tract infections in menopause? I don't get it. Well, the same thing, estrogen, that keeps your skin perky on the outside, keeps your organs and the things that support them perky on the inside.
I gotcha.
So your bladder and urethra that are controlled by that, begin to lose some of their perkiness, if you would, and that makes you more susceptible to urinary tract infections. And we hear women say, you know, I rarely had urinary tract infections when I was young, and then after menopause, I got them all the time. What's the deal?
I have a family member that's like that. They're like, wow, this again? I did not know that. I did not know that the two were related. That's amazing to me. What we didn't know was quite a bit. More for me than you, but you guys were really smart on a couple of them. Thank you so much to Dr. Frida.
Thank you.
For all of the information we've been discussing, it's all there for you and more up on our website. Up next.